morning. My name is Dr. Karl Mehta. I'm a consultant pulmonologist uh, associated with Malya and Hosmat hospitals in Bangalore. As my esteemed colleagues have already discussed regarding the topic of COVID-19, how to maintain good healthcare, especially when it comes to respiratory healthcare, they've already discussed how to use the importance of use of hand sanitizers, the use of masks, proper social distancing, what are the signs and symptoms a patient may have who's suffering from COVID, um, and other aspects which they've covered in great detail. So I don't want to repeat that. I thought I'd bring something different for people to understand, and it's something that's being reflected even in the media. It's something that's being reflected online. Is that the issue that I'd mainly like to tackle is why are people so reluctant, and the difficulty they're finding with staying in home isolation. I understand there is an economic disadvantage that people have. The fact that they're not getting their monthly paychecks realized is, but similar to people like us who are on a service-based payment. So there are certain things that there are hiccups in one's life that take place, and we have to be prepared. So savings and being smart about how you live your life is very important. And it's also important to stay positive, because there is light at the end of the tunnel. We just have to be patient. This is a test that we're going through. So I'd like to focus on the fact that people are finding it very difficult to stay at home because they're all hardworking individuals, whether it's a small business, whether it's a profession, whether it's working for a company, whether it's local or multinational. You're not used to spending so many hours in the day with your family anymore. And even when you do, you're on holiday and you have some other activity to keep you busy and keep you engaged. When you're at home, people are wondering, what do we do at home with our children, and what do we do at home with our wives? And there are all these kind of issues that are coming up. I think it's important that we realize that this is a time to reflect on ourselves, spend time with the families, reconnect with our families. And the best way to do it is not only getting to know them better by spending time opening up, talking to them, talking about your profession. There should also be you should also, once you've understood what their interests are, you should plan activities around that to keep the family engaged. Apart from movie nights, it's always very good to have activities, whether it's games like Monopoly or Pictionary. There are lots of things you can do to spend time with different people in the family. And I think that's one of the very important things that will lead you forward and help you move forward, help you pass the time. The other thing you can do is work on professional development as well. You can assign your children activities, homework, make it fun for them so they're engaged. And while they're engaged, you can look at developing yourself, whether it is spiritually, whether it's academically. There are lots of opportunities. It's just that you have to be smart enough to find it. Go through your investments, do your taxes early. There are lots of things that can be done to help it. Once you're mentally healthy, you'll be emotionally a lot happier and a lot healthier. And then it just it just snowballs to where you feel healthier as well. So there shouldn't be negativity, there shouldn't be too much anxiety. These are the things that you need to look at. The second concern people have is, they seem to get ailments during this time. It's normal. We all get coughs, colds. So there are platforms now offering telemedicine. So you should utilize those platforms which are being provided. Utilize them for telemedicine. Utilize the telemedicine platforms via the app or via computer, and engage with your physician. But don't spend too much time dwelling on it. You have to be positive and move forward. If you have any respiratory illnesses, are all respiratory illnesses COVID? No. However, we have to be a little careful because of community spread. So we have to be a little more cautious. You have to put yourself forward. If you have to get a test, if you have to be inconvenienced for 3-4 days, be in isolation and quarantine till your test result comes negative. You have to do it for the greater good. It's very important that we put our community forward first. I hope this has helped. Good luck, stay safe, thank you.